Hello everyone, my name is Ksenia Ilyina and I'm going to be talking about cultural sensitivity in healthcare. I am an RN and I'm also a student at Northeastern University. This PowerPoint is oriented towards medical professionals, however, general population may also find it to be beneficial. Understanding health in communities means recognizing the equally powerful roles played by the culture of communities. Interpretation and communication about illness and disease, diagnosis and treatment, and caring and curing often is complicated by the collision of cultural communities, whose version of what is at stake may be different. Cultural competence continuum analyzes the steps from cultural destructiveness to cultural proficiency. It includes the following steps: cultural destructiveness, cultural incapacity, cultural blindness, cultural precompetence, cultural competence, and cultural competency. Why is it important to be culturally sensitive? It means developing sensitivity to communication in ways that allow us to learn from one another. In that process of communicating, we negotiate with providers for the care, support, and emphatic treatment that we need and desire, deciding what is critical and compromising as we go. It is important that we recognize how cultural competence will help us to make better choices. Recognize how different healthcare perspectives of patients can be compared to their care providers. Recognize that different people have different attitudes about seeking healthcare. Recognize the importance of making decisions about treatments together with patients and their families. Recognize what the patients and families believe about the healing process. Kotelnikov came up with the six fundamental patterns of cultural differences. Six of them say what's different. He states communication styles, attitude towards conflict, approaches to completing tasks, decision making styles, attitudes towards disclosure, and approaches to knowing. He also highlights six things that are hidden from the surface. He specifies beliefs, values, perceptions, acceptions, attitudes, and assumptions. Do you think there is anything that you can add to it? So, what happens when we are not culturally sensitive? Poor health outcomes, frustration of patients and care providers, poor health promotion, patients don't show up for follow ups, prevent patients to seek medical help in future. The cultural gaps grows bigger. The desire to find a working compromise gets smaller. People don't see a reason to go to hospitals. Communication message is left poorly delivered. Why should we promote cultural awareness? So, being active in approaching cultural sensitivity. Understand that it is the key in participating patient centered care. Work on building a healthy rapport between patients and providers that is based on cultural awareness. Help yourself and others with educating about cultural differences. Understand the community we serve and what it is comprised of. Be aware of our own biases. Thank you so much. I hope you enjoyed the PowerPoint.